I'd like to call the Health and Human Services Committee meeting for Tuesday, January 17th, 2023 to order. Madam Clerk, will you please call the roll?
Alderman Gunther,
Here.
Alderwoman Middlebrook,
Present.
Alderwoman Rice,
Present.
Alderman Todd,
Present.
Alderman Page, Alderman Grass, Chair Ingracia,
Present.
Alderman Page, Alderman Grass. We have
Here.
5, Alderman Grass. We have 6 present. We have a quorum.
Thank you. If anyone has had an opportunity to review the minutes from our last meeting on November 16th, I would entertain a motion to approve those.
So moved.
Second.
Madam Clerk, please call the roll.
Alderman Gunther,
Aye.
Alderwoman Middlebrook,
Aye.
Alderwoman Rice,
Aye.
Alderman Todd,
Aye.
Alderman Page, Alderman Grass,
Aye.
Chair Ingracia,
Aye.
Alderman Page. We have 6 aye votes.
Thank you. By your vote, you have sustained the motion and we have approved the minutes for the November 16th meeting. We are going to move to committee discussions. We don't have any board bills or resolutions for review today. We have representatives this morning from the St. Louis Office of Developmental Disability Resources, the Senior Services Fund, and the Mental Health Board, who just wanted to give us a preview of the work that they've been undertaking and allow us to ask any questions that we might have. So thanks to all of you for taking time to be in front of us today. Do you have a certain order in which you would like to present to us? Okay, all right, Shailene, I'll have you go first then. If you could just raise your right hand quickly, I need to swear you in. Do you swear to tell the whole truth and nothing but the truth?
Yes, I do.
Okay, if you could just introduce yourself quickly, and I think you should have the ability to share your screen. If not, I think we can give that to you because I believe you have a presentation. Is that accurate?
I do. Okay, is that working? Can you see my screen?
Yep, we can see that.
Okay. So my name is Shailene Plank, and I am the Executive Director for the St. Louis Office for Developmental Disability Resources. Just to give you a little bit of a brief history about our office, we are what's commonly known as the Senate Bill 40 Board. That is the legislation that was passed in 1966, allowing local taxing districts to assess the special real estate tax for the purpose of providing services to people who have developmental disabilities. So in 1980, the city of St. Louis put this to the ballot and passed the tax levy so that people with intellectual and developmental disabilities could receive services. So our office was formed. And then in 1982, we began funding agencies and did so with 15 agencies at that time. Then in 1988, it went back to the ballot, and St. Louis City residents voted to increase the tax levy to its current rate of up to 15 cents per $100 of assessed valuation. Then in 1999, our targeted case management program was also established. So there are really 2 sides of our agency. So we have the tax levy board, which is the funding side of the agency. And then we also have our targeted case management side of our agency, which is a contract with the Department of Mental Health. And we provide those services through Medicaid billing. So we are currently one of 89 SB 40 boards in the state of Missouri. So a little bit about us by the numbers. Oops, sorry, went too far. We currently fund 38 partner agencies, and that provides services in 77 different programs to over 1,000 individuals in the city of St. Louis. Right now, in our targeted case management program, we provide services to around 500 people at any one time. Last year, we provided services to 538 people total in our targeted case management program. We receive over $6 million a year in tax revenue. We have a 9-member board that is appointed by the mayor of St. Louis City. And right now we have 33 employees. So a little bit more about who we serve. We provide services to people of all ages, but they have to be diagnosed with a developmental disability prior to the age of 22. So an example of those disorders would be someone with an autism spectrum disorder, cerebral palsy, an intellectual disability, epilepsy, or really any other mental or physical impairment that's likely to continue indefinitely and results in substantial functional limitations. To be provided services in our targeted case management program, individuals have to be at least 3 years of age and receiving Medicaid. There's a few more demographics on the side of this slide. I won't go through those, but you will all be provided the PowerPoints from all of us today, so you can reference those if you're interested in more demographic information. Our funded services. So in fiscal year 21, we allocated $5.6 million to our funded agencies to provide services to people with developmental disabilities. We really try to fund a diverse and ever-growing portfolio of services. We try to look at service gaps and the evolving needs of individuals with developmental disabilities when we make our funding decisions. Quality assurance is very important to us. We are a recipient of taxpayer dollars, so we hold our partners to high standards and a level of accountability. Each year they have to undergo the funding, our funding, well, they have to do an application, and then they have to go through an evaluation process every year. And so that can either look like a self-evaluation that they submit to us, or an in-person review and monitoring. So a little bit more about the funded services that are provided. So we fund in primarily 4 different areas. That's independent living, community connection, employment, and agency support. So independent living could be funded services if someone is still in their natural home, but wanting to move to a more independent situation, we can fund services that help them with that, or they could be in their own independent living environment and just need some supports to maintain their independence. So we provide funding for that. We also do some community connection programs, so funding things like camps, socializations, retirement support groups, some therapy and counseling services. What we've seen an increase in a lot lately with so many people being affected by the staffing shortages is an increase in funding for adaptive equipment or assistive technology. That has helped a lot of people maintain their independence, especially when they can't get staff support. Also some in-home respite for families, out-of-home respite for families. We help with that also. Employment services, we fund employment training, different types of employment services, supported employment, and then some employment transportation. And then finally, we fund agency supports, and that can be in the form of capital improvements, one-time funding, or agencies can come to us throughout the year for emergency funding if needed, and we will look at that. A little bit more about our targeted case management program. So our targeted case management program, we're not providing services. What we're doing with this program is really providing linkage to services. So our case managers are doing individual support plans with our consumers, and making sure that they are linked to appropriate and necessary government benefits, medical services, educational advocacy services, community resources, employment services, housing, and any other interrelated social or educational services. And then, like I said at the beginning, we are one of 89 SB 40 boards in the state. Locally, we work very closely with 3 other SB 40 boards, and that would be the Productive Living Board in the county, Developmental Disability Resource Board in St. Charles County, and Developmental Disability Advocates in Jefferson County. And the 4 of us, we fund many of the same agencies. So some of our bigger agencies like Easter Seals, UCP, which is United Cerebral Palsy, St. Louis ARC, those bigger agencies and lots of other agencies, they are providing services in all 3 counties and the city. And so what we found is that the 4 of us, we were doing things just different enough to be annoying and burdensome to our funded agencies. So in 2019, the 4 of us decided that we were going to come together and we were going to create a integrated technology system. And so now our funded agencies can apply for funding from the 4 of us through one portal at the same time. They can submit all of their corporate documents one time. It comes to all of us. We're able to review those funding applications together. Our funded agencies can invoice us through that same portal, so they're doing their billing through the portal. We came up with a standardized list of outcomes that we want to measure for all of our services. So our agencies are choosing those outcomes when they do their funding requests. They're reporting on those outcomes through this shared portal. So it has really reduced the administrative burden on our agencies. We monitor the agencies together when possible, so they are not having to prepare for 4 different monitoring visits from us. We're doing those together. And it is, so we started this in 2019. We're on our 3rd year of gathering outcome data, and we get a little bit better at it each year. So we are able to report those outcomes by county or city, and then also as a region. So we're getting better and better about on how we report the impact of services and the impact of the tax dollars that are spent. So this has been a great partnership. And I think our agency, well, I know our agencies really appreciate this work that has been done to streamline things for them. Just a few additional resources for us. Our board meetings are the 2nd Thursday of the month at 5 o'clock, and that's 6 months out of the year. The schedule is on our website at stldd.org. Please check us out on Facebook. We are sharing lots of resources all the time that may benefit residents in your ward. And our annual report, 2021 annual report, is on the website. Our 2022 annual report should be coming out in February, and I'll be sending all of you a copy of it, but it'll also be on our website. And just really appreciate the opportunity to share with all of you today what we're doing in your area.
Thank you so much. Really appreciate that. Before I open it up to the committee for questions, I have 2 quick questions for you. I was really happy to hear that you've joined forces with some of the other agencies in the area. Have you had any conversations about sub-minimum wage and sheltered workshops in your work together?
I mean, it comes up because it's always an issue. But we all fund sheltered workshops and consider that, you know, part of the array of services that people can choose from. I know our sheltered workshops work very, very hard to make sure that all their employees have a choice. They are, you know, continually checking in with them about the choice of working in a sheltered workshop, and they have services in those workshops that help them seek competitive employment in the community if that's what they are wanting to do.
Okay, I appreciate that. And I know it was something that a number of other persons were pretty passionate about when we debated our
Yeah.
minimum wage increase. And I think that is still there. And I think that the temperature around the country and even obviously with the federal government is really changing in terms of folks just not thinking that that's a fair way to compensate folks for their hard work. So if you could continue to bring those conversations to the forefront, I would sure appreciate that. And then I'm just curious if you have any vacancies on your board right now, if there's anything that we can be doing at the Board of Aldermen to encourage making sure that you have the support you need in terms of a board of directors to help with the work you're doing.
We do. We have one vacancy, but we do have an applicant for that position that is currently going through the vetting process, I think, with the Board of Aldermen. So hopefully we can get that spot filled sometime soon.
Okay, great. Alderman Gunther, do you have any questions?
No questions.
Alderwoman Middlebrook,
I have no questions. Thank you.
Alderwoman Rice,
No questions at this time, but thank you so much for your work and for coming and presenting with us today.
Thank you.
Alderman Todd.
Well, no question, but I would like to commend you for the great work you've done and the information you gave today. My question, I guess I do have a question. How will we be receiving minutes or anything? How can we get the information that you shared with us today? Because I couldn't take notes. I wasn't taking notes and listening at the same time because I was focused on what you were saying and I didn't take good notes. Is there any way we can get the information in two ways? Number one, what you said today, and number two is, can we get the information on the different programs? You mentioned different programs, you mentioned resources that you have. Can we get that information so we can share it with our constituents?
Yes, so I shared the PowerPoint with Christine and Gracia. So I think you're going to share all of our PowerPoints with the committee when we're done, right?
That's correct. So all of the PowerPoint presentations are in the handout folder and under committee discussions in the drive, Alderman Todd. And then if there's any additional information that you would like to pass on to me, I'm happy to share it with the committee as well.
Okay, I can send you a copy of our annual report that you can just share directly. That way people don't have to go to the website and get it.
Perfect. Thank you so much. Really appreciate that. Does that help, Alderman Todd?
Yes, that helped a lot because I'm not as a literary. When you mentioned the drive, I'm not even sure if I could get it off the drive. So
I'll forward it to you. No worries. No worries at all.
Okay, I have to be honest. I'm just not into the drive. I'm from old school, you know. And
That's
so
fair.
I'm battling, trying to just keep my head above water. So if you would, Madam Chair, if you would just forward it to me, I would certainly appreciate it. Thank you so much.
Sure thing. Alderman Grass.
I just want to actually, I'm new to a lot of this, so I want to pick up where Alderwoman and Gracia mentioned. So can you explain a little bit more about the sub-minimum wage? So are we paying folks minimum wage now? And when Alderwoman and Gracia said more conversations, I didn't know if we need to do work to make them be paid minimum wage, or can you just explain a little bit more about those kinds of programs and issues?
So we're not paying people wages. The workshops are paying people wages. And so wages in a workshop are determined by productivity levels. And so there are many people in sheltered workshops that are making minimum wage or above minimum wage, but there are also people that are making sub-minimum wage. So it is based on productivity levels. So that still occurs in the state of Missouri. It's probably a much longer discussion than what you have time for today. So it really just depends on how much information you want.
So I'm sorry, I didn't mean to cut you off.
No, go ahead.
Well, I guess so. Is that authorized by the Senate Bill 44 that you're allowed to pay people under, or that these workshops are allowed to pay people sub-minimum wage?
No, it's state statute.
Right, the state statute.
But it's not the SB 40 board state statute.
Okay.
It's different.
Okay.
And that's the statute that's challenged. It's been challenged, but it remains in effect. in the state of Missouri.
The statute that allows
Sub-minimum wage.
folks sub-minimum wage. Okay, but that's a different part. That's a different law than that authorized you guys.
Yes.
Okay. Nothing further for me. I just, I was disappointed to hear that there's an issue with that. So if there's, anything that you can get the board, or if you want our help or our voice to try to do what we can to help that, I'd certainly be supportive.
Yeah, and I can send you more information about that if you would like. And also, we can, like I said, it's a much longer conversation and I don't want to take up all your time with that today, but we can certainly talk outside of here if you want more information about it too. I'm happy to do that.
Sure.
Okay.
Great. Thanks so much for your time today, and appreciate you being willing to send along some additional information. And Alderman Grass, I'm also happy to debrief with you. I've worked on this quite a bit behind the scenes off and on, and have not been able to make any real progress, but it's one of those things that sort of falls on and off my radar with all the fires that we have to put out here from time to time. So moving on, if we could get Jamie Opsel from the Senior Fund to present next. Jamie, can I swear you in really quickly? Oh, are you ready to go off mute? Great. Do you swear to tell the truth, the whole truth, and nothing but the truth?
I do.
Okay, great. And if you're more than welcome to share your screen and the presentation with us whenever you're ready.
Okay, sorry about that. I was.
No worries.
Okay, excuse me. Can you see that okay?
Yeah, if you're able to expand it, that would be great.
Oh, it's not expanding. Okay.
It looks like you might have one of the little scrolly things, like the computer's having a hard time catching up, maybe. Oh, there we go.
That works.
Okay. Well, thank you all for, again, like Shailene had said, for inviting us to here today to talk about our programs and services that we provide in the community, the city of St. Louis. So the St. Louis City Senior Fund was created by a voter-supported ballot initiative in November of 2016. And the approved legislation allows the city of St. Louis to levy and collect a property tax of 5 cents per $100 of valuation for the purposes of providing services to persons 60 years of age and older in the city of St. Louis. So as you can see here, if you own a property in St. Louis City, our tax makes up about 6% of your total real estate bill. So if you owe $1,000 in real estate tax, it's about $6 of that tax. We're here. Mental health that you'll hear from Cassandra is here. Shailene, you just heard here. And then Cassandra also talked about the Children's Service Fund as well. So St. Louis City became the 55th county in the state of Missouri to have a senior tax. All of these, except for those in green, are property taxes. Those counties in green are sales tax. So I just wanted to provide you a summary of our grant spending from fiscal years 19 through 21, since we are new. So in fiscal year 19, it was the first year that the board was appointed, and we, within 6 months, had 17 total awards go out into the community to 17 organizations based upon our needs assessment results. We were not able to get out the full amount, but we were able then to increase our spending in the next 2 years, as you can see, with the net position from the first year. In fiscal year 21, we saw a 56% increase from the year previous at $2,568,833. We awarded 69 grants to 48 organizations. Our grants are organized by different categories. Originally, like I said, we focused in what we call our fund-defined grants. These are grants that are focused on priority issues that we obtained from doing needs assessments in the community. Also, excuse me, talking to the people that are in the aging network that provide services, and doing a survey of residents in all parts of the city. And so our fund defined is our largest category. Within fiscal year 21, 66% of our grants were in this category. And then in the second year, in fiscal year 20, the board approved 4 more focused grants, being applicant defined, aging network grants, collaborative, and emergency grants. And I'll go into those in just a few moments. So our fund-defined grants, like I said, are focused on results of a needs assessments and input from community residents and also providers in the community. And we focused in on these 5 key areas. Economic security. 1 in 2 older adults in St. Louis City are economically insecure, and many struggle to cover costs for housing, healthcare, transportation, food, and other expenses. So our senior fund grants focused on economic security were continued from fiscal year 2019 to fiscal year 2020 and 21, and we will continue to focus on this because this is a key issue that we have with older adults in the city of St. Louis. Our fund-defined grants, like I said, are 3-year grants, and the support of these grants are really aimed to expand resources to help older residents reduce their annual expenses and have opportunities for savings and ensure they have what they need to meet their basic needs, such as, like I said, food, shelter, heat, and so forth. Social isolation became a huge issue because of the pandemic, and this focus area aims to support resources to prevent and reduce social isolation and or loneliness for individuals who have a higher risk of these experiences due to changes in physical or mental health, caregiving demands, living situations, mobility changes, and major life events, and or language or cultural differences to others in their community. This is something that has been growing, and one of our grants that we provided to the St. Louis Housing Authority and to CHIPS provided the first evidence-based social isolation programs in the US. In the very first grant cycle we focused in on fall prevention, and it has expanded over the years to not only fall prevention and home maintenance. When we would provide programs in the community that was focused on fall prevention, we found that when we would go in, when our case managers were going into homes, that people had extensive maintenance issues. It was more than just putting a grab bar in. It was people using water out of the toilet because their sink wasn't working. So we've expanded our from fall prevention and home to include home maintenance programs as well. And our home maintenance is also expanded besides inside to outside home maintenance to include grass cutting, getting leaves out of gutters, snow removal, and things like that. We also provide funding for homemaker chore services. And this focus is to help older adults with their instrumental activities of daily living, which helps people stay in their home and remain independent. And so the services can include meal preparation, house cleaning, medication management, laundry, personal care, and errands. And this is really focused on people who don't qualify for the Medicaid program. So for people who are just right above that income guideline. And then finally, we focused in on oral health. And as you all know, many adults lose their dental insurance at retirement because it's not covered by Medicare. And those who lack access and insurance coverage for oral health services may not have the financial resources to pursue care with a private dentist. So this leaves the federally qualified health centers, dental schools, and very few other local clinics to serve the oral health care needs of those who need it the most. And we've had a partnership with AT Stills for the last 3 years, and our board feels like this is extremely important to continue this focus area. So again, our fund, these are all what we call our fund-defined grant spending. We had in fiscal year 21, 34 total awards to 31 different organizations. And let me see if I can. The residents that were served with the fund-defined grants, we've served 3,571 older adults in the city of St. Louis. This is an increase by 23%. The median age was 69. The median income was $12,880. 63% of the people that we served are women, and 67% of the people we served were Black. And you can see from this map how we, since our very beginning, we are serving pretty much most, if not all, zip codes in the city of St. Louis. And we are growing, as you can see, the darker color is that the organizations are serving at least 200 residents in that area. And as I mentioned, in fiscal year 20, our board approves a few other different categories besides the fund defined. Our applicant defined grants are grants that we ask the applicants to tell us what they see are the needs in the community. And as long as it meets and fits with our vision and our mission, then we really want to work with people, because they're the people that are on the front lines seeing the real issues. And so those issues included, again, more economic security and transportation support, health and safety, again, with the home repairs and maintenance, and fresh food and pantry staples delivery, especially during the pandemic, and more social well-being programs, especially for the senior centers that they couldn't meet in person. So we were able to help support virtual senior center programs. And we also supported people that were experiencing hearing loss with free hearing aids, hearing aid repairs, assessments, and so forth through the Center for Hearing and Speech. And then last but not least, we also approved what we call our Aging Network grants. And our Aging Network grants were focused in, was a result of the St. Louis Area Agency on Aging losing significant funding from the intrastate funding formula. And so we were able to help support them with additional funding to do the for Meals on Wheels program. We also helped them to pilot a program, Aging Lift program. Many times the Lift program is very difficult if you don't have the technology to be able to make an appointment and so forth. And so their staff was able to help do those things for their clients. We also supported a reduced bus pass system. And we also opened it up to grants to our 10 senior centers in the city of St. Louis, where they could apply for funding that would help them with purchasing new office equipment, maybe some roof repairs, purchasing, as you can see in this picture, with 5-star new freezers and refrigerators for their home delivered meal programs. So we've been really trying to help support the work of those 10 senior centers in the community. And then last but not least, we also, as Shailene mentioned, have emergency grants that we've opened up since the pandemic. It was focused in the first year really on COVID issues, and now has really transitioned more into somebody stealing a catalytic converter on the home delivered meal van, or again, roof leaks and things like that. So we've been very happy that we can be there to help these organizations that are busy trying to fundraise just to keep the lights on with those unexpected costs. And then last but not least, because we share back office support with the Mental Health Board, we have in the last 2 years done some collaborative grants focused in on older adults with behavioral health issues. And we have found this joint venture to be something that's helped both organizations extremely well. And so I will stop sharing and answer any questions that you may have.
Thanks so much, Jamie. Really appreciate all of the incredible work that you do. And before we move to questions, just also wanted to publicly thank you for joining the Special Committee on Long-Term Healthcare. It's important work that we're doing, and you taking the time to lend your expertise is really appreciated by me. If any members of the committee have questions, if you could just raise your hand and I'll call on folks in order of Alderwoman Rice.
I guess I don't really have any questions, but it's great to see the expansion of your services and reaching more people. And that's always really good to see when we know we've got a population that needs some help. Thank you.
Yes, we have a great staff, myself, Stephanie Herbers, and then a part-time person as well. So we've been able to really expand very quickly, but at the same time do it very, being very smart about how we support the, what kinds of programs and services that we need to support.
Absolutely. Thanks.
Anyone else have any questions or comments for Jamie?
I would like to first of all thank you very much for coming and sharing the information. I had the same question. Will you be able to send the information, Madam Chair, to me?
Yep, I will make sure that you have all the presentations from today after the meeting.
Thank you so much.
Sure, not a problem at all.
I can also let you know that on our website, we have a resource directory so that if you wanted to include that to your constituents, I can also send it to you, Alderwoman Ingracia, as well, if that would be easier, that list all the different things that we fund, because many times, people just are unaware of services. You can also find out about these services through the St. Louis Area Agency on Aging as well.
Great. I'll find that link and make sure the committee members have it to the resources page. Thank you for mentioning it. Okay. All right. Cassandra, are you ready?
I am.
Okay. Do you swear to tell the truth, whole truth, and nothing but the truth?
I do.
Great. Go right ahead.
Okay. I'm going to share my screen here. Okay, can everyone see that? Okay, well, good morning, everyone. I'm Cassandra Kaufman. I'm the Executive Director of the St. Louis Mental Health Board, otherwise known as St. Louis MHB. So much like my colleagues, I just want to give you a brief history. The Mental Health Board, and I'll just call us MHB to make it short, we're a special taxing district in the city. We, however, have two property taxes. We have the Community Mental Health Fund tax and the Community Children's Services Fund tax. And voters approved the first mill tax in 1992. They established our organization in 94. And we've been making grants since 1995. And then in 2004, we passed the Community Children's Services Fund tax and also received our first federal grant. Most recently, in November of 2020, voters approved a 6% increase to our Community Children's Services Fund, abbreviated as CCSF, and we reached the statutory ceiling. That additional 6 cents brings in about $2.8 million additional dollars, specifically designated to serve the social and emotional needs of young children, early childhood from birth to age 5. And then at the bottom, you'll see our mission statement. We're on a mission to improve the quality of life for city residents by investing and participating in a coordinated system of social, behavioral, and physical health services aligned with community priorities. Just to give you some highlights, much like Shailene, our FY22 annual report will be coming out in February. So the data here is from the last full complete fiscal year. So in FY21, we invested $14.4 million from local tax funds and federal grants, and I'll talk a little bit more about that later, to 50 different nonprofit partners serving 11,607 children, youth, and adults by offering mental health, substance use, and prevention programming. So in that fiscal year, we served a little over 5,000 children, 4,700 adults, and through a SAMHSA federal grant, we served 354 individuals and families who had children with serious emotional disturbances. One of the things that we've done in most recent years is begun tracking how many of the people served through our tax funds are experiencing homelessness. And in FY21, over 1,200 or 11% of the total people we served were also experiencing homelessness or housing instability. And that's particularly important for us. As you may or may not be aware, many of those experiencing homelessness also often experience mental health disorders, substance use disorders, and co-occurring issues. Another significant thing that we did in partnering with the city and state was to provide operations funding for the opening of the Donica Sobering Support Center that helps to divert intoxicated individuals from the emergency departments and from jail. We have a board of 13 trustees. Statutorily, based on our bylaws, we can have up to 15. They're appointed by the mayor and approved by the Board of Aldermen. And we currently have 2 vacancies and 5 pending applications for those 2 vacancies. So you may see things coming through in the next couple of months for your approval. We also have 13 staff members. So this just gives you an idea. In order to serve those 11,000 people, we had a $15.5 million budget. And I know the print is really small, but our largest source of revenue is from the Community Children's Services Fund. It's almost 3 times as large as the Community Mental Health Fund. And you can see we have other sources of revenue that I'll talk about in just a minute. So the Community Mental Health Fund, we invested a little over $4 million in 21. The focus was improving the quality of life for city residents, typically adults ages 19 and older with mental health and or substance use disorders. We offer a wide range of services, but the goal is to help them to achieve behavioral health wellness, either through prevention or recovery in the areas of health, home, purpose, and community. These are some of the statistics from those years. 4,700 people improved their behavioral health and recovery, and listed there is how we knew that they did that. We also had people who successfully prevented their conditions, they maintained their status, and those with severe and persistent mental illness improved their ability to function, get or keep a job, and maintain stable housing. A vast majority, or 86% of the people we served, also participated in early intervention programs. So we have a statute, just like our 2 counterparts. These are the different types of services that the statute can support. And the reason that prevention is purple is that that's also a significant part of the work, is helping to prevent mental health and substance use disorders before they worsen. So early identification, early intervention are really important. And you can see the range of different services. Many of these are similar to what the Children's Services Fund also supports. One thing you may not be aware of is, because of the number of people experiencing homelessness that also have mental health and substance use disorders, one of the paths to recovery is helping people experiencing homelessness get into housing. Housing is health. And so since 2011, monies from our Community Mental Health Fund have provided permanent supportive housing. And what we've actually done is provided organizations with 10-year forgivable loans to actually create units of permanent supportive housing. So here on the screen, you'll see 2 different examples, one in the Central West End, which is a congregate living setting, and one in the Bevo neighborhood, which are 4 different apartments. These were all created through funding through the Mental Health Board, and so they provide permanent housing that also makes supportive services available to people. Okay, now we're going to just turn a little bit and talk about our Children's Fund, or our largest fund. In FY21, we invested over $7 million. Both tax funds currently use 3-year competitive grants, and we also participate in community collaborations with other funders, often with other partners, supporting the development of a coordinated system of care for children. The fund focuses on behavioral health, addressing trauma, and providing support to families. So in FY21, we served 5,658 children and youth. Much of it was through prevention-focused programming. And then we also do universal school-based prevention programming. Okay, here's some of the outcomes. I won't read all of these to you, as you'll have this presentation as well as this information is available on our website. So these are some of the ways that children improved their emotional health, became socially connected. All of the work we do, much like our colleagues, is grounded in evidence-based practices, research, and local needs assessments that are done to determine the needs of the community that involve community residents, key informants, and lots of research information. Here are the statutory areas that we can fund in. Again, the prevention programming is purple, and part of the reason is when this tax was passed in 2004, what you see in purple was the ballot language, funding prevention programs which promote healthy lifestyles among children and youth and strengthen families. And so this Board of Trustees has taken what I consider a very progressive approach to prevention and has really focused in investing in that area, in addition to the other services that you see: respite care, temporary shelter, outpatient substance use treatment, etc. This also supports a telephone hotline called the Youth Connection Hotline, available through the behavioral health response, that can connect children and families to emergency services. At the very bottom, you'll see there are limitations on the use of the children's fund, so we cannot pay for inpatient medical, psychiatric, or substance use services, or for transportation services. In addition to our 2 tax funds, we also have federal grants, and we've had 9 years of SAMHSA funding for something called the System of Care. And these grants are nationwide, many of them across the state of Missouri, but it's essentially a collaborative network of organizations, families, and youth that are focused on the health of children who are either at risk for or have serious emotional disturbances. And the goal is to help them be successful at home, in community, and in school. Many of these children have very complex needs and interface with multiple systems: the child welfare system, the mental health system, the school system, etc. We receive about $1 million a year. And one of the things that's really important, not only does this fund services, but it also allows us to do system building and create infrastructure to serve many of these families. Some of the key partners are listed below: Vision for Children at Risk, the city and county family courts, Children's Advocacy, BJC, Behavioral Health, and the Hopewell Center. Often the federal grants allow the Mental Health Board to serve both the city and the county. We also have another strategic initiative you'll see a little bit later, but the St. Louis Area Violence Prevention Commission, which is not a legal entity, is housed within our organization. Their director is a member of our staff. They receive outside funding, which you'll see on the right side of your screen. We invest $40,000 annually, but there's well over $1 million budget. And the focus is really to align, convene, and connect organizations that are addressing gun violence, prevention, and reduction, with a particular focus on youth and young adults. And as we all know, the gun violence and youth violence is an issue in our city. Okay. So I threw this in here, I thought this might be helpful. So in addition to the 2 tax funds, which is our core work, the Mental Health Board also does a lot of different partnerships. We currently have 2 federal grants. As I mentioned, the Violence Prevention Commission, we serve as a backbone and provide administrative support and fiscal support. As Jamie mentioned earlier, we have an administrative agreement with the Senior Fund. They co-office with us. Their controller is our controller, etc. We do some grant making together. We also do fiscal sponsorships, and often we partner with the city. So currently we're partnering with the newly formed Office of Violence Prevention, serving as a fiscal sponsor for a national private foundation grant. And we have, at the request of different city departments, since the start of the pandemic, distributed funds. Like in FY21, we did over $2 million in CARES Act funding that went to early childhood providers. This current fiscal year, we have distributed another $2 million of American Rescue Plan funding. in partnership with the Community Development Administration. And we also have a $1 million grant with the Health Department for youth safe spaces, which aligns with the violence prevention work. Lastly, we often try to leverage Medicaid funding through the state of Missouri and the Department of Mental Health. So one of the ways that we pay for outpatient substance use services for adolescents 12 to 17 is by taking our tax dollars and leveraging Medicaid dollars through the state to pay for those treatment services. And then lastly, our board meets on the third Thursday of the month at 5:45. This month will be the first time our board is meeting in person since February of 2020. So we'll be doing a hybrid meeting. It will be available on Zoom, but in person. And we're going to be meeting at the Deaconess Center for Child Wellbeing because we've outgrown our current office space. You can connect with us. Our website is listed there. Find us on social media. And for the first time, the information that I've shared with you is virtual on our website. So we don't actually have a printed annual report anymore. It's all available only through our website. So let me stop there and welcome any questions you may have.
Thank you so much for that impressive presentation. I'm on meetings with somebody from MHB, it seems at least every other day for the various work you're doing in the community. Do any members of the committee have questions or comments for Cassandra? Alderwoman Rice?
Thank you. And thank you, Cassandra, for your presentation as well and for the work that your organization does. I was curious about the line at the bottom of the slide that said that you couldn't fund inpatient or transportation services. Could you talk a little bit more about why?
Certainly. When they passed the statute, there was concern in the General Assembly at the time that if these local ballot initiatives in the different counties allowed funding that it would take all of the funding because transportation services can be all consuming if that's what you do,
Sure.
or serving somebody through inpatient services. So that's why they placed the limitation.
Okay, so it's more so that you have resources available for other.
That's
for other work.
correct.
Okay, that makes sense. Yeah, I think that is all the questions I have. I do appreciate that you always let us know when you're having meetings and that the agendas are available. That's really helpful for us as well. Thank you.
Anyone else have any questions or comments for Cassandra? All right, thanks to all three of you for spending some of your morning with us. We appreciate the updates and all the work you're doing, and please keep us posted if we can be supportive with anything that you're working on.
Thank you for having us.
Absolutely. Have a great day. Do we have any announcements from any members of the committee? All right, I'll go ahead, Alderwoman.
Madam Chairman, could you update us on the special committee and like when meetings are going to be and how we can tune into those?
Yep, thank you. That's a great question. So as many of you are aware, the board passed a resolution to create a special committee on long-term healthcare facilities. We've been gathering members and doing some preliminary research and having some preliminary conversations, and we'll be meeting almost every Monday between now and April 10th, starting next Monday at 3 p.m. Those meetings will be public. We'll be bringing different stakeholder groups and individuals before us to testify. And I believe that IT and the clerk are working on getting a web page set up on the city site so that other persons and also members of the public are able to follow along with the work that we're doing. So if any of you have any ideas or you'd like to jump on to a meeting and have anything that you'd like to weigh in on or ask questions about, please keep me posted. Alderman Todd?
Will this special committee, are we who on the Health and Human Services Committee, are we members of that committee?
You're not, but you're more than welcome to join us if you'd like. I had sent an email out a couple of times a while ago, and Alderwoman Boyd and Alderwoman Davis joined. The three of us are the only other persons serving on the committee right now, but if you're interested, I'd be happy to add you.
Okay, my plate is full, but I was just wondering. I was just wondering if I didn't want to miss one of our meetings that I'm currently on.
Sure, yeah, so with the exception, I think now of President's Day, we'll be meeting every Monday at 3 o'clock. Generally just an hour from 3 to 4, and those are publicly noticed meetings. I believe they're already on the aldermanic calendar, and alderpersons should receive panelist invitations if you're able to join for any of those.
Okay, then I just didn't want, I wanted clarity on whether or not our this Health and Human Service Committee was the same. So since so it's not the same, so.
Right.
Okay,
Right.
then. Okay,
Yes.
thank you so much, Madam Chair.
You're welcome. Any other announcements? All committee members were present, and I would entertain a motion to adjourn.
So moved.
Or did you have something? No, okay. All right, can I get a second on that?
Second.
All in favor signify by saying aye.
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 Opposed, motion carries. Thanks for your time this morning, everyone.